Chinese city on lockdown, the world on alert, as the so-called Wuhan coronavirus continues to spread. Today on The Nexus, we're looking at how it started, how it's spreading, and the race for a vaccine. We'll also be hearing from a virologist on what to do if you think you have the virus. Plus, the Chinese doctor, a hero who was threatened for trying to warn the world. And snakes, wolves, and civet cats. Is it time for China to shut its live animal market? Well, it's a controversial question, and we'll get to all of that in a minute. But first, a quick reminder of how the media's covered the story from Wuhan to the world.
The coronavirus has spread to countries across the world, but officials believe that it all started in Wuhan, China.
At the epicenter of the coronavirus.
Large-scale quarantines, unprecedented in size.
World's never seen anything like this.
This is the epicenter of this novel coronavirus. The lockdown of Wuhan and surrounding cities continues.
Officials there say the virus is now spreading faster.
It is impossible to tell when the Wuhan coronavirus will peak.
The race is on to stop this new and still mysterious strain of coronavirus spreading.
Rail stations across the province have largely shut down. Flights have been suspended and police checkpoints have been set up on main roads.
Experts say it won't stop the virus because many had already left the area.
After the lockdown, China has been unable to control the coronavirus.
The virus, which originated in Wuhan, has spread to every region of China. And it's still spreading across a range of countries.
Countries are racing to stop it spreading.
New cases are still popping up around the world on a daily basis.
The mysterious new pneumonia virus that sickened dozens of people in the Chinese city of Wuhan has been confirmed in Thailand.
Japan has confirmed 3 new cases of the virus.
A new case in the United States.
This morning, there are 7 confirmed cases in Australia.
Here in Singapore, 2 more cases.
There are 2 cases now in England.
Canada has its first confirmed case.
This is where the first person in Germany was infected.
The Philippines has reported the first death from the new coronavirus outside of China.
It's now been declared a global health emergency.
Well, there's no shortage of alarming headlines and sometimes misleading ones too. This video of a Chinese woman eating a bat has been doing the rounds, and it's actually quite misleading because it's in the wrong place and the wrong time. Now, we're going to get to that later in the show. But first, let's bring in our guests. And in Singapore, we have Lyle Fernley, who's done a lot of research on China's so-called wet markets. We also have Dr. Eric Feigl-ding, an epidemiologist who knows a lot about how best to stop a virus spreading. And finally, Professor Ken Steadman, who has plenty of experience in finding vaccines. Now, we're going to start with Professor Steadman, and we're going to start with some simple questions. A lot of people are asking about this particular coronavirus. It is winter in the Northern Hemisphere. A lot of people have colds. Some are going to get the flu. How do they distinguish between that and this coronavirus?
So the key is getting testing quickly. And so the first thing you want to do is you get sick very rapidly. You have usually a relatively high fever. You feel really badly. First thing to do would be to cover your face and nose and then go into your doctor and get a test.
Now, Professor Steadman, if you look back to, say, SARS or MERS, people are quite interested to know if it is more dangerous or less. What are the crucial factors you look at when trying to make that assessment?
So it appears that this novel coronavirus actually has much lower mortality rate than SARS or MERS. We're still lacking a lot of data in terms of understanding that, but it looks as if the SARS virus had about a 10% mortality rate, and the MERS virus is even higher than that, probably over 30%. This new coronavirus, again, the numbers are not completely clear, but it does look as if it's around 1% to 2%, maybe at highest 3% in terms of mortality. So much less mortality. However, it does seem to be potentially more infectious. Certainly more people have been diagnosed with having this disease.
And another problem is that you don't necessarily show the symptoms, but you may have it.
That is, again, a great question. We're still in the very early days of this, but that does seem to be the case. You can have the virus and be infected and not necessarily show symptoms. That's probably why it's potentially being spread so much more rapidly.
And you mentioned the mortality rate compared to the flu. I think they put the flu at something like 0.7%, is that right? So it's far more lethal than the flu.
Given the numbers that we have now, yes. The question is, how many people really are infected with this new coronavirus? And I think the answer is we don't completely know.
Indeed. Dr. Feigl-ding, we've seen a lot of people using masks in order to, prevent themselves getting the coronavirus. Do you think they are effective?
I think masks are, to some degree, effective in terms of limiting your exposure. But surgical masks are not airtight, and N95 masks are pretty rare, and they're pretty difficult to breathe. And there's such a worldwide shortage. We can't rely on masks, per se. And regarding the transmission, there's a lot of controversy whether it's asymptomatic transmitting or not.
Right.
There's Chinese reports that it might be. There was a German report, but that was retracted. I want to emphasize that was retracted recently, and it was just reported that the woman who transmitted it in Munich, Germany, did have symptoms. But there's an underlying question, and it's hard to calculate the mortality rate because we have such an underdiagnosis. There are estimates for the incidence at 7 to 8 times higher than what the Chinese government have been reporting for the past week. So the numbers are all over the place, but it's pretty clear that this has much more faster transmission and incidence than SARS.
Okay.
Lower mortality, but again, the other difference with the flu is no one has any immunity. While a lot of people, we have a partial flu vaccine, and people have partial immunity to the flu.
Understood. That makes sense. Well, let's dig a little deeper into this now, and let's look at how it spreads. The two main ways to stop the spread, quarantine and vaccination. Let's look at quarantine first. And people are being held in medical facilities all over the world. As for Wuhan, well, the whole city of 11 million people is in lockdown. Here's the view from one Russian visitor.
And suddenly you look down in your apartment, you're afraid to go out. Of course, there is a lot of panic everywhere. So the numbers of confirmed cases are still quite scary, and it's rising every day quite a lot. That's why I decided still to be evacuated to Russia.
Well, Vladimir has now been evacuated from Wuhan to Russia, where he's been placed in quarantine in Siberia. Dr. Feigl-ding, how effective is quarantine in managing these types of outbreaks?
Well, classical quarantine is you quarantine one person or one family in a household. Lockdown of an entire city or entire province, like with 50 million, 60 million people, is not classic quarantine. You could just make it spread even faster within that area. I think the extending the Lunar New Year holiday, making sure people stay at home, I think it will slow down a bit. But in terms of spreading outside, because the WHO emergency was declared for the potential to spread to other countries, I'm not sure because there's a lot of evidence for person-to-person transmission in Hong Kong now, that of people who've never been to China who now have symptoms, and there was a mortality in Hong Kong recently of a 39-year-old young person. So the quarantine, I'm not sure because no one's ever done a citywide, province-wide lockdown.
This goes back to the case of SARS. Quarantine was effective in that case. It didn't last long enough to bring a vaccine to market.
Yeah, that's right. For SARS, we were able to defeat it within 3 or 4 months. It took the vaccine eventually arrived 9 months later, and by then the SARS was already dying down. And luckily, we didn't actually have to use the vaccine that much. Vaccines will take a while. This case, it's soaring so fast, though. I don't think we're going to be able to defeat it in 3 months. Just for comparison, it took 3 months to reach 8,000 cases with SARS. It only took 1 month for this, and right now we're double SARS right now.
And just presumably the difference was in SARS, you had much more visible symptoms that you could identify people who needed to be put into quarantine.
Right. SARS, the key difference is SARS was not infectious during the incubation period. It was only infectious once you develop symptoms, which allowed the quarantine system once you have something, lock it down. For example, if someone was flying on an airplane and then they fell sick the next day, but they were perfectly healthy on the airplane, you don't have to track everyone on the airplane because they weren't symptomatic. But now it's much harder to lock down if they've been spreading even when they were asymptomatic. And that's the major difference with SARS potentially. But there's still controversy around that.
Well, despite efforts to quarantine people, the virus is still spreading. At the time of recording, these are the countries with confirmed cases. And for the very latest information on how the virus is spreading, do follow the link in our YouTube description there. Now, Dr. Feigl-ding, just one more question on spreading. Some countries have now closed their borders to anyone except their own citizens coming from China. Intuitively, that seems the right thing to do, but not everyone agrees.
Yeah, that creates a lot of fear-mongering and stigmatism, especially of people from a certain country. It's tricky. The incubation, we estimate, is around, on average, 5 days. But an average of 5 days means half the people are still longer than 5 days. I think 14 is a good precaution. I think right now, in the critical phase right now to contain it, I think it is critical to lock it down with some travel restrictions. But it can't go on forever.
Okay, so we've dealt with quarantine. Let's turn to vaccination. Research teams around the world are working on finding one, and Australian scientists have already managed to reproduce the virus in the lab. Let's go to Professor Stedman now, who's spent a lot of time finding vaccines. How do you even start in a case like this?
The best thing to do, again, is as the Australians have done, and also the Chinese have done too, is to make the vaccine in a system where you can control it, and then look at how that particular virus is interacting. So now you have the new coronavirus, it's infecting now a lab animal, usually a mouse, and then you come up with a vaccine to protect that animal from being infected by the actual virus. So that's the key, why vaccines take such a long time to develop, and it's probably years before we're going to actually get a vaccine. In the case of SARS, as we just heard, it was probably about a year before a vaccine was available. Really, all that's doing the testing to make sure it works in the mouse models, and also then testing it on humans to make sure that it doesn't make us more sick.
Does the past actually give you any good indicator of what will happen in this case?
Vaccines have always taken a very long time to develop. And in this case, people are talking about it being a few months. That would be amazingly fast. Generally, vaccines take on the order of years to decades before they actually come to fruition. But there's a lot of new interesting technology that's happening now, which might allow us to get, instead of years, looking at months in terms of getting at least the technology available. But it just takes time to do the testing and to make sure that this actually works, and make sure it works in a model system before you start testing it on humans.
Okay, let's look at where the virus came from now. And we know that the experts at the World Health Organization believes it likely started in bats. But how did it get to humans? Despite what you've heard at this stage, even the scientists are not entirely sure.
Under the microscope, the coronavirus family have something in common, a distinctive feature. SARS, MERS, and now 2019, NCOV. All have a crown or corona of sugary proteins sticking up from the surface, and all are believed to have originated in bats before probably spreading to other animals and then humans. SARS was first reported in Beijing in 2002, MERS in Saudi Arabia a decade later. In that case, camels were the intermediary. As for 2019 NCOV, or Wuhan coronavirus as it's colloquially known in the newspapers, experts believe it also started in bats. That's because the genetic structure is 96% identical to a virus that researchers found in bats back in 2013 at a cave 1,500 kilometers away in Yunnan. The very first fatal cases of Wuhan coronavirus back in December were frequent visitors to the Huanan wholesale seafood market, and so experts believe it likely jumped from animals to humans here. The so-called wet market trades in all kinds of exotic animals, alive and dead, including peacocks, wolves, camels, but interestingly, not bats. So researchers deduced that one of these animals must have been infected by a bat and then transmitted the virus to humans. The market has been in lockdown since the beginning of the year, but the damage is done.
Dr. Lyle Fernley has spent quite a lot of time researching China's wet markets and joins us now. Could you define for our viewers exactly what a wet market is?
Sure. So actually the term wet market apparently originally comes from Singapore and Hong Kong English, and it was used to distinguish wet markets where fresh produce, meat, and animals are sold from dry markets where dry goods are sold, things like textiles. In the context of the media reporting on China, it's been quite vague what kinds of markets they're referring to, because in China there's actually a great diversity of types of markets, including markets that have live animals versus markets that only sell slaughtered meat. Some markets would have wild animals, whereas others would have just conventional poultry.
I just want to read you something from the Wall Street Journal, very recent article. It would be hard to design more opportune conditions for new viruses to emerge, tightly pack together a variety of species from around the world and transport them across borders directly into large wet markets. Ensure that these massively stressed and immunocompromised wild animals are in close proximity to domestic and farm animals, then distribute these animals to urban populations for consumption. And it says that the title of this article was Abolish Asia's Wet Markets. Is this overstating the case, or is there any truth to what they're saying?
Certainly, there's a lot of evidence of increased viral presence in many live animal markets. So if we're specifically talking about live animal markets, that is the case. However, there's also been a lot of experience with regulating live animal markets successfully. For example, in Hong Kong, they've instituted certain policies such as rest days and viral surveillance, and it's been quite successful at keeping, at actually managing that. Another important reason why abolishing these markets might not be the best solution is because in previous instances where that's happened, it's often driven the trade underground. What you have now in China is a lot of trade taking place over the internet, over Taobao. And that's actually a site that would be even much more difficult to regulate than actually centralized markets. So I do have concern about what would happen with the sort of perpetual closure of the markets.
Now, in your experience, you've seen them being quite well managed and in some places, especially near the capital, highly regulated. But people will ask, is there anything more the Chinese authorities can do to mitigate the risk?
Yes, certainly there's a lot that can be done. Wild animal farming is not regulated under the Ministry of Agriculture. It's regulated under the Forestry Administration. And they don't have the same kind of experience and veterinary expertise that you have under Ministry of Agriculture. This means that some of the risks coming from the wild animals may not be because of their exotic species per se, but actually just because of the way that they're being regulated currently.
Thank you. Of course, there has been a mixed reaction to China's response to the crisis. The World Health Organization has praised China's efforts, but China itself has admitted shortcomings and deficiencies and been accused of trying to hide the outbreak. One Wuhan-based doctor who tried to warn fellow medics about the outbreak back in late December was told by police to stop or else. Dr. Li recently shared a copy of the letter police made him sign after he started talking about a group of patients in his hospital with a SARS-like virus. He also revealed he had contracted the virus. Let's go back up to Dr. Feigl-ding now. Do you think there have been shortcomings? Do you think the Chinese government knew about the coronavirus outbreak well before it announced it? And if so, by how much?
So just for the virus history, the genomic analysis suggests that it made its jump from animals to humans around sometime in early to late November. And the first two identified cases were actually in early December. And interestingly, the first two cases in early December, according to the New England Journal paper, had no exposure whatsoever to the wet market. Only the later cases in late December did. So maybe it was reintroduced to the wet market there. But I think clearly the cases if you look at the chart, started growing in late December. So I think they should have reacted as soon as late December or much earlier in January. And that is well established. And right now, the other issue is the underdiagnosis. They do not have enough infrastructure in place. They do not have enough testing in place. Is it all their fault? I don't know. Maybe it's the local governments that try to squash negative info. But right now, they are trying to do their best.
I want to talk about the WHO for a moment. A number of experts say that the World Health Organization has gone too far in its praise and should have held China up to a higher standard. Would you agree with that?
The WHO was very gushing, even when they declared the emergency. I will first say, on January 22nd, when they declined to declare the emergency, there was not any information about the transmission, like the R0 or the incubation. And hence they decided to defer it. And 7 days later, they declared it. And during that time, we learned so much. All the pre-printed articles, all the research had come out from Imperial that the R0 was 2.6, which means for one infected person, it transmits to 2.6 additional people in a serial way. We did not have that data early on. But when they declared it, they were still very, flattery of China. I don't know why, but I think China, I will agree that China is doing the best it can as of now. And that right now, sometimes during an epidemic, what's in the past is water on the bridge, and they can relitigate that in the future. But right now, getting everyone, China's cooperation, international cooperation, and getting everyone on board together to stop this epidemic is the most important.
Thank you for that. Now, right at the beginning of the show, we showed you a video of a Chinese woman eating a bat. It was widely circulated video, which has recently emerged. The thing is, it was actually filmed from 2016 and was filmed by a well-known Chinese food blogger in Palau, a tiny Pacific island nation, thousands of miles away from mainland China. Dr. Feigl-ding, it's sort of like the elephant in the room, if you like, but it's a bat in this case. People don't want to be part of perpetuating stereotypes that can be very harmful to relations with people, but they do want to ask, basically, are bats eaten in China, and does that pose a risk, a health risk to the public?
People eat bushmeat, people eat deer, hunting gear. All these animals carry various pathogens, and once you cook them, it's not an issue. And so should we be elitist and ethnocentric about this? I don't think so. I'm happy to hear from our medical anthropologists here as well, but personally, I don't think we should stigmatize, because most of the world...
Lyle, I'll just put the question to you directly. Are bats eaten in China? And more importantly, does it pose a actual health risk?
Yeah, I agree with what was just said, that none of the emergence of SARS or this virus actually was from the consumption of bats. It's very unlikely that they jumped directly from bats to humans. In fact, they probably jumped to an intermediary species. And I would also add that another disease that did jump from bats was the Nipah virus in Malaysia, and that actually jumped not into a wild animal species, but actually into pigs, industrial farmed pigs. So there's a case to be made that a lot of diseases are coming from animals, but a huge number are actually coming from industrial farmed animals, not just from wild animals. So I think that's an important point.
And just a final question. It would appear that experts believe that MERS, SARS, and now this new coronavirus all actually began and originated in bats. Is anybody here qualified to tell me what's going on with bats, why this happens with them?
I can jump in here. I think the answer is nobody knows, and that's why there is a lot of interest in studying bats. Bats seem to have very large numbers of what we would consider nasty viral diseases that seem to circulate in bats and don't cause any problems in bats. Bats do have diseases that do make them very sick. In the United States, we have this white nose syndrome that's literally killing off millions of bats. So it's not that they're resistant to all diseases, but why they're resistant to some of the viral diseases which are much worse for humans is a very open and interesting question. And I think that's a reason why we need to study much more the animals and to understand what's going on in terms of viral disease, and maybe concentrate a little bit less on the humans, because that's going to be where the next outbreak comes from, is from some of these animals, be they domestic animals, be they wild animals.
Professor Stedman, Lyle Fernley, and Eric Feigl-ding, thank you all very much for your contributions to the Nexus today, and thank you for watching at home and on your phones. Remember, you can see this and all our previous episodes on our YouTube channel. Till next week then, goodbye.